Hello, viewers, and welcome to Africa and Beyond the Television Network. And we are taking a look on what is happening in the nation of Zimbabwe. The Ministry of Justice, Legal and Parliamentary Affairs introduced a new bill in Parliament. In this new bill, it targets private health institutions. And we need to take a look on what is really happening and what is really transpiring. So the government is going to determine fees charged by private health institutions. What it means is whatever which they are going to charge is going to be solely determined by the government itself. This was announced by Ziyambi, who is the Minister of Justice. And we need to critically take a look onto this new move and understand what is really happening. So there is a policy which is called a Medical Services Amendment Bill, which was introduced in Parliament mid-July. And this empowers the Minister of Health to prescribe maximum fees and fees increase allowances for private hospitals and clinics. And any increase beyond the caps requires ministerial approval. So whatever which happens, they will need to have ministerial approval. So under the key clause, which is named private health institutions, private health institutions must admit and stabilize patients with life-threatening conditions for at least 48 hours, even if the patient cannot pay. So this clause is very important because anybody who approaches the private hospitals and does have a life-threatening condition, they will have to be attended, even if they don't have any cent, any money. The question is, will this also apply to public institutions? Because we've seen that there is a norm in public institutions that if you do not afford or if you don't have money for A, B, C, D, you won't be attended. For example, sometimes you have to pay money for some pills, for some drugs, whatsoever. Will this also applies to the public institutions? So that will be something which we expect the legislators to debate upon. And also, when you look at the regulations, they will extend special provisions and care packages to vulnerable groups. And this include children, persons with chronic illnesses, war veterans, persons with disabilities. And, this is something which is very, very important. There is also a proposal for what is called a National Consultative Health Forum. So that is something which is happening. So looking at the effects of this new policy, we have seen a lot of people who are critics or analysts and activists. We have seen them giving their own views and thoughts regarding this new policy, which is being debated in Parliament. And these include the issues of revenue constraints and the pricing control. What it means is if pressure is put on private institutions, remember they are driven by profit. So if it's no longer beneficial for them to perform their duties, there is a likelihood that they will have to shut down. So revenue constraints are likely going to cause these private health institutions to close if they are no longer profitable. And also another issue is about, will they be able to run or their operations properly, buy equipment, pay staff, and at the end of the day, be profitable? That is something which is very important. When you look at smaller clinics, they are more vulnerable than others. So the bill will need to also consider all those activities. Then financial exposure from emergency care mandate, which is being introduced. It's something. Is this program not going to be abused deliberately? For example, someone who is supposed to go to Parenyatwa will choose to go to a private hospital where they know that there is equipment and doctors are available, nurses are available, there is more care, knowing fully well that for the next 48 hours, they will be attended to. Are we not going to see this system being abused? Are we not going to see these institutions being overwhelmed? that is another point of debate in Parliament. Our legislators will need to debate along those lines. So the mandatory 48-hour admission for emergencies, even for non-paying patients, it exposes providers to unpaid costs because they will need to pay doctors. They will use their own drugs and medicines. They will use their own equipment, but they are likely not going to get anything out of that. The government is not so clear if they are going to chip in and pay a certain percentage to these institutions in the case that they are not paid and they are running costs which need to be covered, the expenses of running these institutions. So that is something which is very important as well. So when you look at this bill, there is also an issue that clinics must now need to monitor fees schedules. They need to apply for ministerial fee increase approvals, and they will need to navigate administrative procedures. So in as much as critics are criticizing this bill, to a certain extent, it's quite reasonable because you see that the health system in Zimbabwe, it has become too exorbitant and too expensive. So if the ministry is then to put some caps, I believe that those caps, they need to be discussed between the health institutions, their representatives, and the government. I don't think that the approval should solely come from the ministry only. It must come to various sectors. That is what is going to bring more transparency and to bring more efficiency. So that is something which is very important. And also, if care is not taken, there is a likelihood that the clinics will reduce the quality of health care which they have been providing. They might even reduce the availability of certain procedures, which also might put patients in tight situations, even those who can pay. So there have been mixed reactions from the medical community. We have seen a lot of criticism of this bill from medical professionals. They disagree with this bill. We've also seen political activists and other advocates speaking their mind regarding this whole issue, and they've urged the government of Zimbabwe to focus solely on improving the healthcare standards in public hospitals, because they're arguing that the best way is to make sure that you provide better healthcare in public hospitals, because no one wants to go and pay exorbitant fees. So if you put services in your own hospitals, you force the private sector health institutions to lower their prices automatically, and it does make sense. So that is something which is very, very important. So there is a lot to talk about, but we need to take a look just briefly who stands to gain or lose. So we have benefits, we have challenges, and what are the benefits of this bill? So when you look at patients, especially the people who are poor or who will be critically ill, they are going to have some benefits, because they will be able, in emergencies, they will be able to access better quality, affordable medication. And but it's not absolute, because you are likely going to have an effect on quality if the government does not put reasonable prices. Then when you look at the institutions themselves, what are the benefits? So they've been profiteering a lot. So if new regulations come, it means they're going to have less revenue, which is also a challenge to them. So when you look at the government as the regulators, they are going to have an issue of public trust. They are going to have an issue. The problem is public trust, because the people say you are focusing and targeting private health institutions because you don't care about the public healthcare institutions. So that is a very, very, very valid point. And this is something which we need to broadly discuss and understand what is really happening, what are the effects, the impact, and whatsoever. So we'll be closely looking at this bill or following this bill so as to understand and know what happens next. So, Dumisani, thank you very much, my brother, for coming. A very good evening. Thank you very much for this contribution as well. A very good evening, my brother. So, this is what is happening in Team Zimbabwe. This is what we have for you. The government is going to determine what the private institutions will charge going forward if this bill passes through Parliament. So, this is what we have for you. Let us meet in other episodes as well as other podcasts.